Hey guys, it's Alicia from mobilitymastery.com, and I am going to walk you through how to release your quad hip flexors and a little bit of TFL fascia using a foam roller. And if you've hung out with me at all by now, you've probably heard me talk about the quads and quad hip flexors ad nauseum, because it is my #1 pick for what to do if you live in the Western world and you sit a lot, and most of us sit a lot and we're quad dominant. So these hip flexors get very tight, short, tender, sore. Doesn't necessarily mean they're strong, they're just fascially unhealthy. And in order to have a fully optimized body or get out of pain, I definitely want to go into those quad hip flexor tissues no matter who I'm working with. So I made this a separate video than my regular quad and quad hip flexor one because I want to walk you through how to explore this entire region on its own as a separate thing from the quads. So I'm not walking you through the quads, which is the lower part of your thigh in this one. We're just targeting that upper tissue. So we're looking to get anything in this region here, and then the TFL is kind of sitting in the crease here and off to the side a little bit. So I'm going to walk you through finding both. Now, very few people that I've worked on in my private practice where I'm stepping on people don't have adhesions here. Almost everybody does. And in order for you to get the best possible result in the shortest amount of time, it's worth spending a little bit of time up front to find those adhesions in your body and spend the time to release them. So if you're just kind of rolling around on the foam roller, or you're finding tender tissue and breathing and whatnot, and even compression and movement, that's going to be great. But if you find those adhesions and break them up, you're going to get the best possible result. So that's what I want you to do, and follow along here and try to do it for yourself. Historically, I have a really big adhesion here in my left quad hip flexor, and most of us are uneven that way. So there's usually a worse one in my left than my right. So this is probably true for you too. So whatever leg you lean on the most, or always have bent up when you're sitting, or if you play soccer or you're a cyclist, it's probably going to be your right leg. Whatever leg you think you use more or have in a bent position more often, target that leg first and try to find that adhesion. And if you find that one leg is worse than the other, like me, then you're definitely going to want to do that side more or that side only until you're even, and then you would balance yourself out with maintenance by doing both sides equally. So, gonna go face down onto the roller here, onto those quads. Now, I'm pretty high up on my quad right now, so this is a great place to start. I'm not all the way down here, so I'm nice and high. I'm gonna target my left hip flexors right now, because that's my tight side. So I'm gonna use this right leg toe tap to balance, and then I'm also taking my right hand and lifting up. So I'm not all the way down parallel to the floor anymore. I want to get as much weight and leverage into that left hip flexor tissue as I can. So I'm going to be leaning as much body weight as I can. So I'm coming all the way off my right leg here, off the roller, and then this right arm can kind of help me move and find the spot I want. When I find the spot that I want, which is when I have that adhesion or a really sore tender spot, then I'm going to concentrate on moving my leg. So let's just try some leg movements here. So we're going to go back and forth. Boom. So there's my adhesion. So I'm leaning into it, and then I'm trying to shear that fascia. So I'm not just rolling around on the foam roller, tilting my hips from side to side. I'm leaning into that hip, and then I'm trying to slowly shear that fascia with my leg movement. So if you find an adhesion, stay on there for 20 to 30 seconds. Boom. So that's a really big one right there. I don't know if you guys can see that on me. So that's the quad hip flexor part of the technique. So you can do as much as you want on that adhesion. You could lean further into kind of the ITB side and do the same thing, little baby back and forths. Your adhesion might be located in a different place than mine. And once you feel like you've done enough hunting around in that quad hip flexor part, then you're going to roll up even more and really tilt. So I'm going to turn away from you guys right now, but hopefully you'll be able to hear me, but more importantly, just watch what I'm doing, because this is what I want you to do to find that TFL tissue. So I'm really going to lean into that hip. I'm not on my hip bone though, by the way. I'm in a soft tissue pocket. And when you know you've got it, it's going to feel tender and sore. So I'm going to squeeze my leg in and then straighten it out. And then squeeze it in and straighten it out. Now I could keep it bent and then reach my heel towards the floor and then let it go. And then reach my heel towards the floor, knee comes up so your femur is kind of paralleling the floor, and then relaxing it. So it's kind of a knee wag or wave here. And that is how you can get into some of that TFL tissue. So I'm almost squeezing my glute to get that movement. So again, squeezing it in, straightening it out, and then squeezing it up and down, up off the floor, and then back down towards the floor. So now that you've done one side, get up and walk around, see how you feel before going to the other side to even yourself out. Go give this a try right now, because as we all know, information is useless unless we use it, and I want you guys to use the technique because it is such a good one for anything head to toe, honestly. It's the number one thing that's going to balance our pelvis out, give us better alignment, and it has ramifications upstream and downstream if you're out of alignment, and then of course if you're bringing yourself into alignment, positive things can happen all the way up and all the way down. So give this a try and share your comments below. I would love to hear how you feel after doing this one. And of course, if you liked it, give us a thumbs up. I would really appreciate it, and share with your friends and family so they can get out of pain too. If you're new here, make sure to subscribe to our YouTube channel and hit that bell, because we have new techniques and tips going out every single week. And if you want to join my email community, I send out newsletters every Monday where you can get tools and stories that will help you live your best life, learn to trust your body, and be able to do what you love without pain. So now that you've tried the self-help quad hip flexor technique, I would love for you to try the Kinetix partner technique. Kinetix is my method of stepping on people, because when you have someone stepping on you, it's even more powerful and you get a way faster result. So make sure to click below to join my email community, and I'm going to send you that technique instantly so you can give it a try. And make sure to tell me what you feel after you try that one, because it's pretty amazing for everybody that does. As always, I hope you're learning to trust your body so you can adventure through life with confidence. See you next time, guys.